Live streaming. Hello everybody, I am Dr. Udaykumar. I am HIV/AIDS consultant and I have been working with HIV/AIDS for last 15 years. I am practicing in Aurangabad and today we are going to discuss a very important topic. That is needle stick injuries and post-exposure prophylaxis. As everybody knows that needle stick injuries are a common concept that happen in medical practice and a lot of people get injured and then panic. They're not understanding how and where and how what to look for is the issue. Today we are going to discuss these serious issues and what should we take precautions post infection. So let's start out with this particular issue. There is some technical glitch. Okay. So what and how we define a needle stick injury? So HCW means healthcare worker or healthcare person when exposed to a needle stick injury is at a risk of getting hepatitis B, hepatitis C and HIV, and hence the person who is at a risk can have percutaneous injury, example a cut or sharp object or a needle stick, or he can come into contact of mucous membrane or non-intact skinning or non-intact skin like exposed skin that is chapped, abrated or affected with dermatitis. Even sometimes blood, tissue or the blood body fluids that are potentially infectious can also affect the person. So worldwide the first documented case of HIV transmission from patient to healthcare worker was a UK nurse who sustained a needle stick injury while obtaining blood from an arterial line of an African patient with AIDS. So that is it was documented in 1984 in Lancet, and as we know that it was something which gave a lot of questions and queries to the medical world, and then we formulated what was use precautions. So are these the only infections that can happen? No, there are a lot of other infections that can also happen. With this, these infections can be they can be blastomycosis, brucellosis, or it can be hepatitis B, C, or HIV that happen. Even malaria, mycobacteriosis, or mycoplasmosis, Rocky Mountain cure, also this can be also the needle stick injuries. So one should be careful with sharps, and these sharps can develop serious kind of infection in people, and therefore we should know how and when to work on this. While working on this particular issue, we need to work on so if you see the risk that is there for HIV is less than hepatitis C and hepatitis B virus. Hepatitis B and hepatitis C virus are more effective, and this kind of infections can lead to more of a current pandemic of infection. But since we are now working with immunosuppressive precautions, we are avoiding all of them. I'll come to that later, but these are the things we should know. So what are the determinants of the risk of transmission? Number one risk that is there is the prevalence of virus in the patient population. As you know, patient population has different kind of categories: high risk category, low risk category, mid risk category, and high risk category people are being defined as people who are having a lot of variations in their sexual life, or those people who travel a lot, or people who have habits of getting into drugs or alcohol or other things. We are shaped with it. Other than that, we also have that what are the exposure? Is it percutaneous, mucocutaneous, or there is extent of injury, is superficial, deep, type of device, the hollow bore, solid needle, or what is the plasma viremia of the source, what is the immune status of the healthcare worker, and what immediate aftercare and use of PEP we have deployed so that we can stop and control the infection. So if you find out the risk issue that we can have, that if it's permanent injury or splash injury or this non-intact skin hollow needle, we have various categories in which we can understand that this kind of infection can happen. But as for now, we should understand the viremia on patient having infection is less in people. Is there any risk from body fluids? Yes, there is a risk from body fluids. There is a known infections of blood, CSF, and non-infections are tears, saliva, urine, feces, sweat, and MSS. So these are non-infectious. Blood and CSF are highly infectious. Even CSF, that is CSF, we have pleural fluid or pericardial fluids or peritoneal fluids, which are also infectious. Even amniotic fluids, cerebral fluids, and tissue samples are infectious. But non-infectious, we know that body fluids which are blood contaminated, or semen, or vaginal secretion, breast milk. A lot of people come and ask that can we feed the breast milk to a baby which is newborn, but there are some recommendations where there is need and there is no need, and yes, definitely there is a thing we should know. And yes, conjugate virus used in labs, they are also highly infectious, we should avoid them. So needle stick injury, what are the main causes? Because most frequently are during and after an injectable that is given to a person. And after that, what happens when we are recapping or we are carrying needles and syringes? If there is a patient movements, most commonly children or any patient who is unconscious or people who have inappropriate disposal of this, there are a lot of things which can happen with needle stick injuries. So coming to the standard precautions, we have barrier protection. We should use gloves most of the times. Other times, we should also have to hand washing or safe techniques. We should also have safe handling of the sharp items or the specimen spill of blood or body fluids, and also use of disposable sterile items is the best way to get away from this. So, what should be the immediate management of a needle stick injury? Immediately, what you should do? You should clean the exposure site. Most important part of the thing. How should you clean it? You should clean it at the running water. You should use the soap and running water and wash it tap water. Then we should not use any antiseptics as it is not useful. Also, using of bleach or caustic soda is more harm than good. Then, if it is a mucous membrane that is affected, then we should flush thoroughly with water. No soap should be applied in the mucous membrane. And if it is in eyes, it should irrigate with a liter of saline. So these are things we can do, and this can help to remove the virus. What else we should do? We should do immediate first step. If it is cut, we should do work it up. Then secondly is the importance to report the incident. We should report the incident to the authority. The authority will find out the risk assessment. After risk assessment, we should do a proper thorough counseling of the person. Counseling includes what are the risks, what can be there, what is the patient's workup, is she pregnant, or if she has any other health issue, that should be addressed, and we should know how to control it. Then the decision regarding use of PEP is there, and lastly is the follow-up. This was the thing we used to do previously, but now as we know that we should be doing all kind of PEP to every person that comes to it. The old is finished, and now we look for that giving PEP to every person that is. Right now, the new recommendation of PEP is dolutegravir, and dolutegravir, when given in a proper dose, helps to control the infection. But how to summarize it? We know that we should be needle smart. So do not recap, do not bend or remove or transport or reuse in needle. That is the takeaway from this. And if you get any issues with this, this is my. You can contact me on my website. I will be happy to help you out this particular issue. So this was uncalled live, but today I think I have made it point that you get it. I will again live. If you like this, you can have a new live whenever you want. Just let me know. Thank you very much, and